There are many factors that contribute to the glaring health disparities in areas like central Brooklyn: poverty, unsafe streets, and less access to active transportation, something the city health department has been working with the Department of Transportation and community groups to address.
We have to ensure that our residents of all communities have access to bike lanes and have access to spaces that are safe, that promote physical activity.
It was unclear, though, until now whether the push to expand bike lanes throughout the city would be successful in lower-income neighborhoods. The city health department has been tracking the use of lanes in Bedford-Stuyvesant and found that 70% of cyclists using the lanes were residents and identified themselves as being healthy. How often do you use the bike lanes?
Every day, coming from work, going home, coming from work, going home. You know?
And how's that for your health? That's probably
good. That's good. That's good. I could do about maybe 100 push-ups right now. You know what I'm saying?
Getting the bike lanes into these underserved communities, though, was not an easy process.
A lot of times bike lanes are seen as a form of gentrification that are coming in, and that bike lanes are not necessarily for the residents that live here.
Roosevelt Philippe uses the lanes often for recreation and to exercise with his kids, but agrees his neighbors may see them as a bad omen.
It's just like with the shootings. There have been shootings out here forever. But since gentrification has been coming on, it's like now we see more police. It's kind of like an insult. It's like we weren't worth it before.
The health department works with organizations like the Partnership for Healthy Brooklyn to bring community members into the process. Adding more bike racks, stop signs, and engaging in discussions about curbing violence helped with acceptance of the lanes. Now there are 10 miles of bike lanes here in Brownsville and East New York, with a total of 28 to be added in 2016.
Social norms are always changing. So what we do hope is that when people do see others cycling and that they're comfortable with doing it, that we'll get more people to cycle.
Erin Billups, New York 1.